Okay, can we come to order, please? Let's see. We stand for the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. And may we have the roll call?
Kathy Bruck.
Here.
Maggie Wilcox.
Here.
Marianne Salem.
Here.
Frank Labarge.
Here.
Dr. Hendricks.
Here.
And Donna Williamson, Supervisor Jean Bishop, and Dr. Wynn and Terry Williams are absent.
And we do have a quorum then, with 5 present. Okay. Next item on the agenda is approval of minutes from April 13, 2016. Does anyone have any corrections? Motion to approve?
I'll move to approve the minutes as presented.
I'll second.
All in favor?
Aye.
Aye. Okay.
Good evening.
Good evening.
You're going to start meeting a lot of new staff over the next couple of Board of Health meetings because we've had a really big turnover this last year. Anyway, I'd like to introduce you to one of the first new of our staff. She's been here with us for 3 months, and she's actually here now because Marianne Salem sent a couple emails to me about a town hall she'd watched about prescription drug misuse and overdosage and how big of a problem it is. She had some questions about some issues related to that, so I asked Michelle Valladingham, who is our new coordinator over our drug prescription overdose program, to come and talk to you about the program and what she's doing here in the county to try to help solve some of those issues. She has a bachelor's in health science, and she's finishing getting her master's in healthcare administration, so please join me in welcoming Michelle.
Hi, thanks for having me. Prescription drug overdose prevention program was recently funded because it is a big problem right now. It's a huge epidemic in all over America, but in the state of Arizona, Mojave County is the highest out of 5 counties of the overdose mortality. So the prescription drug overdose prevention program focuses on 5 strategies. The first one is to reduce illicit acquisitions and diversions of prescription drugs. What we're doing with that is we have 10 drop box locations in Mojave County, whereas we just had 3, I believe, last year. So we've actually increased quite a bit. We are encouraging lockable pill boxes for the community. We actually had some donated, so we were able to actually dispense of them we're focusing on grandparents raising grandchildren. On number 2, promote responsible prescribing and dispensing policies and practice. I go out and I speak with all prescribers. Well, we have 772. As far as I know, to be exact, and trying to get them all on the same page as far as the SB 1283 that is coming into effect full force October of next year, and making sure that everybody's using the CSPMP or the Controlled Substance Prescription Monitoring Program and knows how to utilize a program to its fullest potential. Number 3, enhance prescription drug practice and policies in law enforcement. Chief DeVries is actually doing really well with this aspect of it. They are working on the training and implementing naloxone, which is an opioid reversal for the law enforcement, first responders. We're going to start with law enforcement, but then eventually it's going to be all first responders, and then also third party. If you are a family member or friend of somebody that you know takes an opioid, then they are able to carry naloxone and have it on hand in case there is an overdose. Number 4, increase public awareness and patient education about prescription drug misuse and abuse. I go out and I also try to educate the public, youth, senior living as much as I can, and try and get that prescription safety and drug awareness out to them. And 5, enhance assessment and referral to substance abuse treatment. We do not have a lot of treatment options in Mojave County. Unfortunately, we only have one inpatient rehab facility, whereas other counties have a whole lot more than that. We are working on getting a 10-bed, 23-hour crisis unit in Kingman in October of this year. That kind of gives them an opportunity to get the patient stable and then find another facility, an inpatient facility for long-term detox and rehab. So SB 1283, that is the new law that's fully passing October of next year. Well, it's the the bill that was just signed, so it'll go into full effect October of 2017, or 60 days after the information exchange has integrated the program data into the exchange. Registration with the CSPMP was actually in effect as of December of 2015. This is a huge law that is concerning a lot of doctors because they don't, or prescribers, sorry, because they're worried that there's going to be some backlash on them if they're not up to par by the time that happens. So they want to start baby steps and slowly move forward. So December 2015 is when they were requiring all prescribers to be registered. And actually it's now whenever a prescriber passes their boards and they get licensed, then they automatically are signed in with the CSPMP. It is required to be utilized as of October 2017 for any new controlled substance prescriptions that will be given out. There are certain guidelines. They can request a waiver now for 12 months if it's a prescriber that is not up on electronic health records yet. It gives them a year to get their systems in order, so that way they won't have any repercussions and end. And also any new prescribers that are getting licensed, then it gives them time as well to kind of get their affairs in order, especially if they're going to have their own practice. Certain exceptions with the utilizing the CSPMP, certain aspects in the ER, they're not going to have to check that because it's normally just acute issues. If somebody does come in and complain of back pain, that is excluded because it's really not a provable diagnosis. If somebody comes in and they clearly have a broken leg, they can take an x-ray. If there's a fracture, they can prove. If somebody just says, oh, I strained my back, they really can't prove that. So they would have to then use the CSPMP in order to prescribe a narcotic. Cancer patients are excluded. If it's administered in the office, inpatient facilities, correctional facilities, things like that are completely excluded. 10-day supply as long as the prescriber has checked within the last 30 days and they know that the patient's not abusing the system, then they can give a 10-day supply if there's some sort of invasive procedure coming up. Penalties, fees, board actions, these are still all kind of on the balance. They're trying to figure out what they're going to do. They don't want to be too harsh, but they kind of want to make sure that everybody's doing what they're doing to eliminate this problem and try and get us out of the number one, being in Mojave County, that's the highest mortality rate. Right now, the medical board is reviewing revoking, suspension, or probation. Obviously, those are extremely harsh. That's more, if there's an investigation or something and the patient came in and has been seen there for several years and all of a sudden they're, wanting these prescriptions and their history has never been reviewed, their CSPMP has never been reviewed, then that's going to kind of throw up some red flags. So as long as they're doing what they're supposed to be doing, there's not going to be really much of an issue. They are hoping as far as like in the future, just because if there's no, they fear that if there's nothing behind it, any kind of consequences, that it's not going to be utilized, and then we're going to just be sitting stagnant. So possibly in the future, they're looking at fines for each offense, say X amount of dollars for offense 1, X amount of dollars for offense 2, and so on and so forth, but obviously increasing throughout the time. In Mojave County, our kids, I'm going to get a little bit more into statistics. Our kids that are going to our schools, there was a survey done asking them, and this is really scary. I have kids in school. 10% of our 8th graders have admitted to using or abusing prescription medications, obviously not theirs. 20% of our 10th graders and 25% of our 12th graders. Pain relievers are the most frequently used. When I go out and educate the public and community and just anybody I talk to in general, I try to, make sure that they understand just talking to your children can put you at a 50% less likelihood that they're going to go out and use drugs or prescription medication. Last year alone, 19.7 million pain relievers were prescribed in Mojave County alone. So there's that many out there, and it's easily accessible, unfortunately. As of those kids that admitted to abusing prescription medications, 14% of them take it right from their home cabinet. The other 14% get it from a parent or a family member, and 67% of them get them from their friends. That's too high of a number. So this is the newest data from the Arizona Department of Health Services. As you can see, our highest mortality rate age is 45 to 54. They've passed the 55 to 64. Believe it or not, our 15 to 24 is actually lower. But again, the overdose rates are including the accidental overdoses. When you're taking a prescription medication, sometimes you get foggy brain or you forget, did I take my medication? Oh, I'm not sure, but I must have forgot. They take it again. They're at risk for overdose. The 5-year average for opioid-related overdose mortality rates, Mojave County is number 1. We're at 14.5. And this is out of more than just the 5 counties that are being funded for this. The 5-year average for pharmaceutical opioids, the ones that are 19.7 million that were prescribed, again, we're at the highest at 13.9 rate per 100,000 residents. So this is really scary because it's not going to resolve itself. We have to do something, or it's going to just get even worse. Our heroin-related overdoses are actually in the lower end, 0.8. Unfortunately, we're most likely going to see that number rise as prescribers are cutting back on giving them the opioids because they're wanting to cut them back. Well, when they go through withdrawals and they can't get the treatment they need, what are they going to turn to? They're typically going to turn to heroin. I have a little short video I'd like you to watch.
I'll never see her again. I'll never hear her voice, hear her laugh. I'll never get her married. Hold her children. I'll never, ever hear her call me mom again. Good morning, son. Wake up. Wake up. Grace, wake up, honey. No? Honey? Baby, wake up. Oh, God. No, 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 no. Honey, wake up. Wake up, Grace. Don't do this to me. And I'll never forget having to choose the coffin for the one thing in life that I was truly proud of.
So I know that's pretty powerful. My goal is to have it hit home and have people emotional and have tears and go home and hug their kids and their family members because, sorry, no matter how many times I watch it, it's still very emotional. My clicker doesn't work. But thank you. It is a big problem, and there is one easy, simple thing that we can do as moms, dads, brothers, sisters, cousins, aunts, uncles. All we have to do is lock up our medications. It's not going to prevent the problem everywhere, but it's going to be a huge, huge deterrent. Lock them in something simple as just a little lockbox or a safe if you're that concerned. Take inventory if you take the medications on a regular basis. Make sure that there's not an issue. Keep track of your refills. If you notice that you're refilling quicker, more sooner, if you're refilling sooner than you normally would, then you know that there might be an issue of some sort. Then you can address that at that time. But as far as locking up your own medications, disposing of expired and unused medications, that's something we can do on our own. We have, like I said earlier, 10 drop box locations, 2 of which are in Kingman. One is 24 hours a day, 7 days a week, and the Sheriff's Department is Monday through Friday, 8 to 5. Take your expired or unused medications. It does not even have to be prescription. It can be vitamins. You've got gummy bites now. Children can actually overdose on vitamins as well. So anything that's expired, unused, they don't take sharps, liquids, or creams, take them down there. You don't have to remove your name, the label, or anything. Everything gets incinerated. So none of your personal information is going to go out. But those are certain things that we can do to help protect our loved ones. Is there any questions?
Is that list on your website?
No, we have Mojave Substance Abuse Team, which is a coalition I'm with. We have a Facebook page, and we just have the Kingman locations. I'd be more than happy to disperse that to, put it on there or email it to anybody.
I think it would be a good idea if somehow you could get it out in the public.
When I go speak with prescribers, I make sure I have smaller flyers for the specific town that I'm in. for all of the exam rooms. I have larger posters for any of the waiting rooms, anywhere else that I can get those put up, the pharmacies. So I am dispersing as many as I possibly can. An online digital format. We do have Bullhead, who did add it to their website, but we don't have anything posted locally right now.
Okay, I think it would be good if you could. I mean, I'm aware of, they do it once a year in Bullhead. They have a big campaign in the newspaper, but to know that it's always there.
Right. Sorry.
So exactly how many, you said you have 10
We have 10 in Mojave County.
in Mojave County. Where are they exactly?
We have 1 in Bullhead, 2 in Kingman, 2 in Havasu, 2 in Fort Mojave, and 3 in Peach Springs. And we actually do have 1 for Las Vegas Metro and Laughlin, because a lot of the residents in Bullhead go to, that see the doctors in Bullhead live in Laughlin and vice versa. So we wanted to make sure that we included them. I just didn't get that on there because that's really recent.
I have a couple questions. First, now, you mentioned that that you're working in partnership with through the Community Health Improvement Plan Substance Abuse Committee, right? So that's with Chief DeVries and with Sarah Knievel, Dr. Sarah Knievel. So so that's all being coordinated. Can you tell me, what are you seeing as far as compliance with the CSPMP?
It's slow. I am getting a lot of positive feedback from the majority of the prescribers. I do have some old school doctors that, are more paper in the face. They don't want to deal with computers. Now there's one more thing, and I just try to encourage at that point in time that this is a tool. This is a great tool that's going to help make sure that they're not prescribing something that may interact with a medication that they're prescribing, even if it's not controlled that they're prescribing. I try to encourage them, use it anyways. That way, sometimes your patients forget or don't remember or just clearly just don't want to tell you what they're taking. And there might be an interaction somewhere. So if they just utilize it and at least kind of get to know their patient and what they're taking and what specialists they're seeing, it kind of gives them a better idea.
Are you aware, I assume, but I don't know, is there some kind of formalized communications that are going to doctors about reporting and the requirements and the penalties if they don't comply by 2017 or start complying?
No.
Okay.
That's where I come in. That's why I prefer a face-to-face with the prescribers, because a lot of things get missed in emails. You get an email, you kind of scroll through, there's attachments, you're like, I don't have time for that. It gets pushed off to the side, it never gets looked at. I prefer the face-to-face. I have folders for them that has everything in a paper format, and they have all the resources for a digital format that has the controlled substance guidelines on proper prescribing. It's part of my initiative to make sure that they all have that and have access to that. And as well as the amended SB 1283 bill. So that way they have kind of like a highlight of what's to come. Mm-hmm. And when they do have all of their information updated with the CSPMP, they are notified of changes and updates. I'm finding a lot of times a lot of the prescribers registered, but they have to renew it every other year. And a lot of times it's not getting renewed. So their information is not in the database to where all that information gets sent. So any of the updates, because they don't know if it's accurate information or not. So they kind of fall off that end.
Okay.
How many prescribers have you seen so far?
About 130. And this is my
How
third
many
one.
do you see in a week?
It depends on, right now it's a lot of vacation time. I was seeing 10, 15 in a week. It varied. I was so busy for a period of time, I didn't have time to make more appointments, so now I'm at my desk making more appointments, and then I'm going to be super busy for another couple of months. So as many as I can. Sometimes I get
On the high
clinics.
side, how many do you see in a week?
The most I've seen in a week, I want to say 37, but that's when I've had a group. I try and do groups as much as I can. Dr. Knievel, Chief DeVries, and myself are meeting with the CareMC ER department and the residency clinic all in one in 2 weeks. So
Now, that kind of thing is a captive group, though, and you've got a ton of physicians in Havasu and in Kingman that are separate practices. And if you're seeing, say, 7 in a week, and you've got 600 more to see, or say you're seeing 10 in a week, and you've got 600 more to see, that's 60 weeks. So that's going to take you over a year.
Well, my position is actually able to get a part-time, so we're working to fill that to help me out with that, so I can be more out on the road and, hitting the streets and making sure that I have a full schedule to see them on, try
But
and get them
when
all
does this
covered.
have to be done for the physicians?
They have, it by October 2017.
October 2017, so
That's when they're
A year
supposed
and
to,
a half.
you might make it.
Well, you've
Through
got more than
everybody.
just physicians, too.
Yeah, you've got
You've
nurse
got dental, you've got PAs,
practitioners,
you've got,
Yep.
yeah.
772 prescribers.
Oh, okay. I have one other question. When you're talking about educating the public, what are some examples of ways you're doing that?
I have, well, right now, my main focus is prescribers and treatment, making sure that they have access to any treatment information. So that's my main focus right now. In between, when I am able to, I've gone to Rotary, I've gone to other clubs to where I can do similar presentation for them to kind of make them aware of what's going on. I'm hoping to start something, it's similar to, it's called Passion Cafe that they have up in Phoenix. I'm wanting to try to incorporate something similar here in Kingman, hopefully in the other cities as well, to bring more of concerns within our community to the table and have people within the community discuss it and get everybody's viewpoints on that and, just kind of get more people together. The more we all have fighting for this and trying to make it better, the quicker it's going to resolve as best it can.
Well, thank you. It's a big job that you're entering into, and appreciate all that you're doing and enthusiasm for solving this problem.
Thank you.
Thank you very much for your concern.
Thank you for having me.
It's that time of year. It's July, and it's our time to present to you our Public Health Department budget. We have presented the budget, obviously, to Finance previous and to the Board of Supervisors, and I believe they vote on it this coming Monday, so we're just in time to present it to you. And I have Diane Schreiber and Jeannie Bowen, two of our administrative staff here to do that presentation, and if there's any questions afterwards, I can help with those.
Good evening.
Hello.
Jeannie's going to handle the clicker, and I'm the mouth of the organization. So,
That's why we don't cough all over everybody.
going from drug overdose to budgets, I don't know which is worse. Finances are always a challenge for the county, And so we want to present.
I've already lost my job.
There we go. We have 37 separate budgets that we monitor. And some of those are administrative, but most of them are grant budgets. Some of them are absolutely required statutorily, but some of them are these grants that do a lot of good. And so we monitor all of those and we budget for them. And we're going to present not each grant budget. If you have questions on any of it, yes.
I'm sorry, I have to ask. Do you have the budget on paper?
Yes.
Because what we have in front of us, to me at least, is illegible.
Okay. Let me show you the budget on paper. This is our budget on paper. It is.
Okay, what I'm asking is what
For you right now?
what you're going to be giving us that we're supposed to look at.
Yeah.
To tell you the truth, I don't really even appreciate you bringing that 3-ring binder over and handing it out. That's not what, and I know you're astute enough to know that was not what I was talking about. So do you have it
The
on?
next slides are much bigger, and
Okay.
the plan is only to show you some of the changes that we're doing in our budget
Could I
this
please
year.
have this on paper, what you just went past,
Yes,
Yes,
so that we can see that?
yes. Shall I go get that?
yes.
All right, I'll be back.
Okay. And I will continue to talk a little bit. We have health administration, and the only revenues we get in health administration are shown here on your slide. We have vital records, which is our birth and death system, and then we have interest from carryover dollars, and then we have general fund support. Beyond that, our expenses in admin are personnel, supplies, and internal services, which is all of those county departments, our IT, our motor pool, those things are internal services. And so this is just a picture of that. Okay. Okay. The new initiative that we're doing in administration is that when our assistant director retired, Patty decided to do a reorganization and split that position because there was a real need for a special programs manager to deal with accreditation and performance management as we've gone forward in that process. And so by not refilling the assistant director position, but instead putting in an administrative assistant, administrative supervisor, and then the special programs manager, both of those positions were able to be created and for the same money that we were paying for the assistant director, in fact, for a slight savings. So we have two people doing a variety of jobs and splitting out a little bit differently. So that's one of the administrative things that happened. Then environmental health is, as you're probably aware, they do our restaurant inspections and those types of things, and they are all, that entire budget is fee for service. So we charge fees, and as a result, at one point in history, all of the health, admin, environmental health, nursing, nutrition, and a few others got grouped together into something we just call the 212s, which is just a number. But what it does is it rolls all those budgets together for a combined picture. The problem with the combined picture is then it's very difficult to track the individual items. So what we put in as a new initiative this year for environmental health is to pull it out of this conglomerate and handle it totally by itself. One of the reasons for that is because they're fee-driven. We don't know if we're charging exactly the right fees if the money that is made under environmental health fees ends up supporting administration or nursing or something else, not just environmental health services. So we decided to split that out, have it stand alone, so it could manage its own, and if we have excess, that means that we can potentially drop fees. If we're running tight, then we need to examine and see if we can need to increase fees. It gives us much better way to monitor those particular fundings. And that's what this new initiative is about. A new initiative means that anything is required to be put in for any change of operation or some new and different way of doing business. And so this was the new initiative for environmental health. For nursing, we have revenues that go in there. Adult immunizations is handled through the nursing budget, as well as support from the general fund. And we have the standard expenses that you see there. We had a new initiative in nursing that, thank you. We have a new initiative in nursing that changes the structure a little bit of nursing. We did not have a supervisor in each area office. We had supervisors in Kingman, and that made it very difficult then to have an on-site supervisor in the office when something would happen, when you would need just that day-to-day checking on how things are going, supporting staff. And so the new initiative would move one nursing supervisor position from Kingman to Bullhead, and then reassign one nurse in the underfill supervisor position to free up a supervisor position in Havasu. So we would now have a nursing supervisor, and that's a working supervisor. They don't just sit and supervise. They do nursing duties, but they are in the office so that it benefits the staff. They have supervisory support. It also helps us as a health department to make sure that policies and procedures and rules and regulations are followed because there's a supervisor on board to watch. Everybody knows when the boss walks in, that's when you behave yourself. If that boss is in a different city and you very rarely see them except at staff meetings, there's not a lot of oversight. So by doing this, it makes a much better cohesive group. And also we feel that the supervisors can do a better job of really making sure that we're all doing what needs to be done and on task. Okay. It didn't help, Louis. What am I doing? Oh, left, okay.
That might, here's another thing too, if you want to override it, just use the arrow key
Okay.
at any point and you can commandeer it.
Okay, thank you. We also had a second new initiative in nursing, and that is part of this reorganization and reclassification of the public health nurses in that division to give a pay increase. with no additional cost to the county. There is no pay increases in the county's plan for this budget year. However, we are unable to fill nursing positions because they can get paid so much more any place else they go to work. So we used to have a very more robust benefits package. And some of that was cut back for new employees. As a result, where some people would come to work for a lower pay because the benefits were good, they got extra time off, and those kinds of things, now that's not the case. So our nurses fall below the 25th percentile in wages. And that's the primary reason that we have positions open. Typically, if we hire somebody, by the time we get them trained on how to do public health, which is a very different task than ER or some of their other nursing duties, they usually go someplace else where they can get a lot more money. And so we spend a lot of time training and a lot of time bringing them up to speed only to lose them. So in an effort to stop this a little bit, we froze one nursing position. And the pay for not paying a person, then we split that out and we reclassified so that nurses would be at a higher range. So that gives those that are currently on staff a raise to a different new level, but it also allows us now to advertise for our vacant positions at a higher level, which we are praying will bring us some applicants that are good and willing to work in public health.
If I may, I'd like to ask a question, if that's all
Sure.
right. Has anyone done exit interviews as to why people are leaving? I mean, you were saying that they're leaving because of the pay or because the benefits were reduced. Is this a fact because you've done or someone has done exit interviews?
Yes, there have
Yes?
been.
Okay. Thank you. Thank you.
Yeah, so we're working with HR. We were trying to come up with a temporary solution to this problem, because the county typically does not, if the whole county doesn't get raises or they don't have that in their plan, individual departments or individual positions do not get raises. So this was a way that we could get that particular classification an increase by freezing that position. That does not mean that we didn't need that position. What it meant is if we have 5 open positions and nobody's applying, we can freeze one for now, and the benefit from that can be used for the others, so maybe we can get 4. That's just the logic.
What is the current staffing level of nurses right now? I see you have 4 vacancies right now, but how many nurses total?
We have 3 general funded nurses. We have our nursing manager, and 2 nursing supervisors currently.
We're down 5 general funded nurses out of 7.5 positions.
What is, I know I've asked this before, but what is there a kind of standard ratio for public health nurses per population? There's not.
There are groups working on it, it's my understanding, but they have not come out with anything yet.
Okay.
It's not like the hospital yet, but there is a group looking at that.
Well, and I would think along with looking at that, they also need to look at geographic area, because I'm aware that the range of area that's covered in Mojave County for that few nurses to cover a county this size geographically. It's got to be a huge problem.
Well, as a part of a solution for losing one of our nurses, for a nurse leaving, to do our shot clinics for back to school, we're bringing down one of the nurse that we have in Colorado City to help out with clinic. That's not a cheap solution, and she's willing to come down, but it gives us a body that can give shots. So, it's one of those things that you do the best with what you have, and this seems to be at least part temporary solution to do this new initiative and go forward with that.
So can I ask what when your budgeting process, I assume this goes to the Board of Supervisors to approve your budget, right? So is there any discussion at that level of what's needed in terms of nurse staffing?
Typically, the budget process is that we are given a budget packet. The health department prepares their budgets and does a presentation to the county administrator and the finance director, outlining our needs and what we've put in to our budget and our new initiatives, explaining those. Then they discuss and they present a budget to the Board of Supervisors, which is where it's at right now, where there's a tentative budget that's before the board. And individual items are brought before the board. And of course, any new initiative is usually looked at carefully because that means a change, that means something different. And so it's brought to their attention then. There is the ability to speak to the issues as needed. Patty?
They have a budget workshop where directors can present their budgets, and I feel very comfortable in talking to board members about the concerns I have, and I have done that individually as well. So they are very aware, as well as the county administrator, in trying to get help for my department since we have experienced a great deal of loss of staff this past year.
Well, the reason why I guess I'm asking that, and I don't know about my fellow board members here, but I'm wondering if there isn't something that, a statement or some type of thing that we need to maybe formulate from the Board of Health that states that there's a concern with the level of nursing. Now, it sounds like you've got a short-term, relatively short-term solution for this year, but long-term, I think it's a real issue, and especially if we have some kind of disease outbreak, I can't even imagine how our public health department would be able to manage anything serious, I guess. And I know I can't really think of a scenario, but just general health issues, and in a low economy population, it just seems really crazy to me. I don't know about my other board members, but the nurse staffing is that low.
This is the first time in many, many years it's gotten to this level, but I think the sheriff's department is also experiencing a heavy loss, so all the board members and the county administrator are very well that it's a safety issue right now and that the two safety departments are having a struggle. So I think the Board of Supervisors is trying to help us remedy that situation. I feel like they're listening and they've heard, so just not sure what they're able to do. The finances are not that great, so thank you, Terry.
Is there anything else? Did you get distributed?
Mm-hmm. Yes.
Okay, let's go. Then we have a new initiative regarding in the nursing division for our sexually transmitted disease grant and program, and that was to hire an 18-hour per pay period clerk for data entry. We have a lot of turnover and vacancies, as you've just heard, And as a result, we don't want to pull a nurse from doing nursing duties to do data entry. That's not practical. It's not the best use of resources. So we need to be compliant with that grant that we have, which requires that we enter patients into the Arizona statewide STD database, PRISM. That has to be completed in a timely fashion. And so we put in to add this 18-hour per pay period clerk to relieve some of the stress from nurses that have been filling in and doing that. We also have a family planning new initiative, and that was to hire a medical assistant. This would be a part-time person to work closely with the nurse practitioner. This staff travels between the offices. So we have one nurse practitioner that travels to all 3 clinic sites, and this medical assistant would do the same thing. Currently, we have nurses assisting during those family planning clinics, and that's one more thing where then they can't do the other jobs that they need to be doing. So to add this medical assistant would free up some nursing time and also provide continuity of patient care. And we eliminated a temp position as a sort of a trade-off because this person could do a lot more than the temp could and assist the program more consistently.
Did you say that this family planning division is mostly funded by grants?
Yes.
So who are the grant?
It's Title 10.
Okay.
No, it's Title 5. I'm sorry. We got rid of Title 10. It's Title 5 funding. Okay. Tuberculosis Control is mandated service, and it is one of those that was in the 212s that we're pulling out and having it stand alone. What is spent in that area is very much determined on our TB cases and what's going on. So if we have a good year, it can be very low, and the grant covers quite a bit of it. But if we have any cases, and especially drug resistant, and those type of things, then general fund is required to support. What has happened in previous years, because it was part of this conglomerate, is when we ran short of funds, the expenses, instead of staying in TB control, would be covered by the nursing budget. That's not a good picture of what needs to happen with TB control. So we requested that it be pulled out and stand alone. So when the grant funds are gone, the general fund knows it has to support because it is a mandated service. So that's why this new initiative. Occupational Health is another one of our 212 budgets that is supported. And so we asked that it be removed from the 212. So again, there's that transparency. We can see exactly what's being paid, what the expenses are. This Occupational Health is supported by Human Resources and Risk Management, and it does not receive a general fund transfer. So we wanted it to stand alone, not to be grouped in with the other health funds.
So is your Occ Health just for county employees? Is that?
Yes.
Okay.
And right now, that position is also vacant.
Yes, because our Occ Health nurse is now our nursing manager and doing an awesome job. Nutrition and health promotion is the nutrition area of our 212s, and it is a very small budget. It's okay. It only has the manager who is funded under that, and she is only funded at like 7% this coming year. Everything else is transferred out and funded by her grants that she administers. So we give the general fund a break, but it is than dependent on grant funding. Then the other one we wanted to bring to your attention is our senior programs. It does get a good chunk of general fund money. It has the WACOG grant. It also has a tremendous amount of support from the site councils at each city. So they put in, and their revenue comes in and goes out. And so it is a very valuable program. The only new initiative we had there was not really a new initiative, it was a capital request. And that is that when you do a lot of meal delivery, the vehicles break down. We put in the general fund, put in for a vehicle replacement. And we've got enough money in there to purchase 2 vehicles. They are delivery type vehicles, Transit Connects, I think they're called. And so we requested to be able to purchase 2 ones to replace ones that are starting to break down. And with the off-road travel, sometimes when you're going to deliver some of these meals, they get really well used. And so they get to a point where you have more repairs and they're in the shop all the time. So this would allow us to purchase those 2 vehicles. Here's our vacancies. In administration, we have an account specialist vacancy. Environmental health manager is still unfilled. In nursing, we have 1 nursing supervisor, 4 public health nurses, and an occupational health nurse. In nutrition, we have an office specialist, an eligibility tech, which is the frontline people for the WIC program. We have the community health education specialist that would be split between the drug overdose program and teen pregnancy. And then we have also nutrition covers senior programs. We have 1 senior programs assistant that just left in Kingman that we're trying to replace. Patty wanted us to put a wish list in here. We want people to be paid for the jobs they're doing. We want those who are here are awesome and working hard, but when you're filling multiple jobs and you have to prioritize to the point where you just don't know which is top priority because there's so many priorities, it becomes a real challenge. So our wish list is for staffing at a level appropriate for each division, and then also when our wish list is that when decisions are made at a county level, that they consider the ramifications to everybody. So in the benefits area, when you consider trying to attract people, when you cut benefits for new employees, it has a ramification. We just want that considered before decisions are made. And I'm not saying it wasn't or that they don't, but it's one of our wish lists that would be part of the big picture. Thank you, and do you have questions for us? I will say that the county budget is online. If you go to the finance department and you go to it has a budget area, and every page, there's 190 pages, that is the health budget. You can read through that at your leisure. And anytime you have questions, we are more than happy to respond and fill you in on what's going on. Anything?
Thank you very much for your report. And thank you for the
Thank you, Jeannie.
Oh, I'm sorry
Credit.
about that first page.
yeah, that was, thank you. Let's see. I guess we have a written report to review for the CD. And after having reviewed that, if you have any questions, do you?
Save it for.
We'll save it for the next time. All right.
Yeah, I don't have anything.
Yeah.
I think a couple of things look better. Flu was down.
Yeah. Called it a public. Is there any? Nope. That's right. And is there a motion to adjourn?
So moved.
Second.
All in favor?
Go ahead.
Aye.